The A is for airway, so we're checking for airway. Now what's different about a baby's airway is that it's tiny, okay? It's like a straw you get from McDonald's. It's a tiny little airway. So if we went and opened it the same way we do for a child, we'd actually overextend it and kink it. You'd actually be closing it again because you're overextending. You see how it kinks it. So when we're talking about an open airway for a baby, we're looking, we call it the neutral position. So just looking horizontally up. Now, in the unlikely event that you find a child, like a baby like this, where they're unconscious and unresponsive, the weight of their head is disproportionately heavier than the rest of their body. So you're going to find it down like that anyway. The baby will be like that. So you will actually be opening their airway by putting a finger on the forehead and lifting and tilting to the neutral position. You don't want to overextend like you do with a child, okay? So that's the only difference for a baby, for airway. But we look, listen and feel for breaths in exactly the same way. So you want to come down, you're looking, you're listening, and you're feeling for breaths. Come right down and you count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If at this point your assessment, if they're not breathing, your assessment is they're unconscious, they're not responding to you, and they're not breathing. It's exactly the same with the child. If you've got somebody there, ask them to call an ambulance. If you've got your phone literally in your hand, pop it on loudspeaker. Otherwise, go straight in and do a minute of CPR and try and get that baby to start breathing again. So the first thing we do, and that again is different, as you've just said earlier, the nose and the mouth are so close together that if you try to, pinch off the nose and put your mouth down, it's going to be very tricky. So you just put your mouth, open it wide, which covers their nose and their mouth, okay? And also for babies are actually nasal breathers. You know that because their tongue is disproportionately big in their mouth. It's not till they get to about 1 that everything equals up. So that's why they've got a big tongue in their mouth. So actually getting the air down the nose helps them. And the other thing about babies, when we're doing their mouth to mouth, a lot of time people are scared and they don't do anything because they think they're going to hurt them or damage them. The thought of putting air into the lungs, I think they're going to blow the lungs up. But this situation, if you're ever in this rare situation, you can't make it any worse. There is nothing you can do that's going to make this situation worse. Nothing. You can only make it better. So don't be frightened, don't be scared, just be very confident that you can do this. Just stay focused. I think we can do this. And when we do, the little lungs are like little tea bags. So if you just go, we call it like cheeks. From our little puffs from our cheeks is enough. And if you do it a little bit too much, the air will just go into the lungs. It won't do any damage to them. So again, you want to come down. This time put your mouth open, then nose and mouth. And like I just said, and come up between each one. 5 initial rescue breaths. Okay? 1, 2, 3, 4, 5. As I said, there's every chance now you get that baby breathing again. Yeah? But if they're not, then we're going to move on to cardiac compressions because we want to pump that oxygenated blood around their body. So because if you did the same you did with the child and put your hand there, you're just going to squash them because they're tiny. So centre of the chest, but how big is their heart going to be? Fist size, it's fist size. So you just think about that sitting there under the heart. So we just use 2 fingers, centre of the chest and push down. The same way. Now we always used to teach that, well in hospitals, we do it this way. It's much easier, feels more comfortable. And we've since last June, when the new guidelines come out, they've now said we can teach that in first aid. So this is a much more better way. But just always remember, if you know what you're doing and why you're doing it, just do what works for you. Sometimes you might have long fingernails, you might be, it's hard that way. So have a practice on both and we do the practicing and you can just see what works best for you. And you do 30. 1 and 2 and 3 and going down a third, which is about 4 centimetres on a baby, to a second. And then after 32, 32, 32, that's your minute, and then you can call an ambulance if you're on your own.